For our international health project, we will focus our attention on implementing a strategy to help with zoonotic disease outbreaks within the Indian region. Zoonotic disease outbreaks are currently rampant throughout this region due to multiple factors, including an increase in population density, deforestation, and a lack of animal vaccine regulation. India is the home of 1.34 billion people, 512 million livestock, and 729 million poultry. The rate of human to animal and human to human contacts are very high. This increases the chance of these diseases being passed. With deforestation and urbanization increasing, it has run wildlife even closer to populated areas, increasing human to animal contact. And finally, the vaccination of animals has not been regulated correctly, causing a perfect environment to harbor pathogens. For these reasons, we will be looking into productive, efficient, and effective strategies that will help India fight these zoonotic disease outbreaks. We will be focusing on the zoonotic disease brucellosis, which is mainly found in cattle, buffalo, swine, goats, sheep, and dogs. There has been progress in controlling this disease in many countries, but there are many regions where the infection persists and consequently transmission to the human population frequently occurs. An individual can become infected with brucellosis if they digest unpasteurized milk or undercooked meat from an infected animal or come in contact with their secretions. This zoonotic disease is highly contagious and could cause serious problems in the bones, joints, and hearts of humans. The most typical symptom of the brucellosis disease is fever. It causes both medical and economic problems for the country. When an individual is affected, consequently, they cannot work or participate in normal activities. The primary effects it has on cattle and livestock are reproductive failures, including abortion, epididymitis, orchitis, and infertility. These reproductive failures equal a yearly economic loss of about 350 million Indian rupees, which is the equivalent of $5 million US. The outbreak of this disease has great potential to harm India's economy. Buffalo and cattle make up 72% of India's livestock, and India is also the largest producer of milk in the world.
Brucellosis milk ring test kits will be produced and sent out to selected villages in the Uttar Pradesh state in northern India. These kits will contain killed brucellosis abortus organisms stained with hematoxylin, kept viable in a thermal container. A small cooler kept cool by freezing salt water in containers and storing them in the cooler. A milk collection jug, disposable gloves, goggles, aprons, alcohol wipes, a notebook, and a pencil. A trained veterinarian with knowledge of the brucellosis milk ring test procedures will accompany a local guide to the selected village by car, motorbike, foot, whatever is most affected. When the veterinarian arrives to the village, he or she will train a select group of herders in the village in proper milk collection practices and brucellosis MRT procedures. Together, the veterinarian and the village will test their herd for brucellosis infection. Results of the test will be recorded and reported to the local health department nearest to the village. If the results of the herd come back positive for the village's herd, another kit made up of the brucellosis card test instruments will be sent to the village, with the veterinarian to train the select group of herders in proper procedures to test the animals and what to do with the animals that are infected. The veterinarian will also train this group of herders in properly handling raw milk and meat, proper disposal of aborted herd animal fetuses and infected animals, and other hygienic practices to prevent the spread of brucellosis. After the villagers are trained in these methods of testing their herd for brucellosis and what steps to take when infection is found will enable them to carry on these procedures independently, only having to request the kits periodically. It's our hope that information recorded from these tests will help create a surveillance system for brucellosis and inspire local governments to set up a vaccination program. Although, even if a vaccination program is set up, this continuing surveillance of testing herd animals will need to be ongoing. We have concluded that the best way to eradicate brucellosis is to continue with the support and participation of livestock producers. Milk testing is a great solution for a small village and other British states from northern India. We also feel that it is a way to help livestock and dairy industries to save money if they use our suggested methods of testing. We will include local livestock owners, other big industries, as well as state veterinarians to help fight brucellosis with affected herds. Studies have shown that if brucellosis eradication program efforts were to stop, the cost of producing beef and milk will increase an estimate of $80 million annually in less than 10 years. Our prevention will not only help save money but also will monitor any contaminations of this disease to humans. Another effective method that we use in the brucellosis is the brucellosis card test, which is fast and reliable um, to diagnose brucellosis infection on stock. Employees can easily test animals since it is a compact kit and easy to use, and the results can come up to 4 minutes after the blood serum and antigens are mixed. Livestock owners and others who work with livestock will be trained by local veterinarians and government local authorities. Regular training and education will be provided to monitor close of any contamination. We will continue on personal hygiene and safe working practices as well. Protection of environment and food hygienes will continue to be promoted.
Considering that brucellosis affects both humans as well as animals' health in the district of Uttar Pradesh in India, we will focus our attention on implementing the testing kits to go beyond the vaccination schedule and thus control the disease. For one, it is necessary to begin with a design plan in which citizens and authorities get involved, so to develop the intervention and have a lasting impact on these people's lives and lead them to adopt it effectively. Also, the cost needs to be affordable for everyone. It means a small-scale intervention that analyzes the difference between the price and the cost, which will lead us to take adequate routes to address and stop the outbreaks. So one way we'll be asking for funding for National Dairy Development Board. Then as we think about the influence in the culture of this part of India, it is necessary to answer questions like, will it get to those who need it? Or will they use it correctly when they get it? Since without this cultural appropriateness, the intervention will never take place, it is necessary to use local veterinarians and other local public health personnel to go into the villages, because the villagers will be more likely to accept people from their own country and area rather than outsiders.